everyone, and welcome to this explainer. Today we're taking some pretty complex clinical guidelines from the Handbook of Clinical Nursing and distilling them down into an actionable, highly focused cheat sheet specifically for your medical surgical rotation. If you've spent any time at all on the floor, you know that MED-SURG Nursing is all about delivering evidence-based care to adults who are hospitalized for some pretty intense reasons: acute conditions, flaring chronic illnesses, or recovering from surgery. So we're going to break down exactly what your care plans need to look like for 5 highly critical patient presentations.
So here's our game plan for today. We'll briefly touch on MED-SURG challenges, then tackle Addison's disease, adult anemia, bowel obstruction, chronic kidney disease, and finally COPD.
Now, we aren't just pulling this stuff out of thin air. Everything we're talking about today comes straight out of the authoritative Handbook of Clinical Nursing, edited by Drs. Hickman, Alphas, and Fitzpatrick. It's absolutely essential that your practice is rooted in the latest evidence, and this handbook is honestly just a phenomenal resource. It's structured specifically to help you quickly understand and actually apply these concepts on the floor.
The authors actually hit the nail right on the head in the preface. They basically point out that healthcare environments are incredibly dynamic, and patient needs, they're just getting more and more complex. Because of this, it's getting harder to keep up with all the evolving knowledge. That's exactly why having a structured, rapid review approach to your nursing interventions isn't just nice to have, it's absolutely critical to your success and, more importantly, your patient safety.
Let's jump into our first condition, Addison's disease. So think about the adrenal glands. They pump out vital hormones: glucocorticoids, mineralocorticoids, androgens, basically the stuff that dictates your stress response, blood pressure, and water balance. Addison's happens when these glands get destroyed, whether that's from autoimmune issues, fungal disease, or malignancy. But here is the major takeaway for your care plan. Because Addison's is a chronic condition that's mostly managed at home by the patient, your primary role as a nurse shifts heavily toward life-saving education and intense patient advocacy. This means your strategy is all about empowerment. You have got to educate your patient on step-by-step interventions to prevent a life-threatening Addisonian crisis before it ever starts. First, educate them on physical stressors. Things like severe injury, an illness, surgery, or even pregnancy can trigger a crisis. Next, teach them the warning signs like fever, nausea, lethargy, or a drop in urinary output. Finally, you have to show them how to time their medications to mimic normal cortisol release and exactly how to handle emergency dosing at home. You know, your education is quite literally their lifeline. A crisis can escalate in a matter of hours if they don't know how to handle those physical stressors. All right, moving to Section 2, Managing Adult Anemia.
What's truly fascinating here is how the raw lab data translates directly to the patient's lived experience on the floor. Anemia isn't just a low number on a chart. The real nursing problems are inadequate tissue perfusion directly related to that decreased hemoglobin and massive activity intolerance because the patient is just severely fatigued. Because of that lack of tissue perfusion, your core nursing interventions have to fiercely prioritize oxygenation and energy conservation. You aren't just letting them rest, you are actively defending their tissue perfusion. You do this by administering oxygen to keep their saturation above 90%. You're checking their skin color and capillary refill to monitor that peripheral perfusion. And just as importantly, your care plan absolutely must include scheduling frequent rest periods to combat that overwhelming activity intolerance.
Let's transition to Section 3, Bowel Obstruction Interventions.
Now, a bowel obstruction is exactly what it sounds like: a severe plumbing issue in the GI tract. But the ripple effects for nursing care are huge. This condition puts patients at an incredibly high risk for fluid volume and electrolyte imbalances due to severe dehydration. Why? Well, they're losing fluid from emesis, their bowels are swelling with edema, and their intestines have basically lost their ability to absorb anything.
Since we know dehydration is public enemy number 1 here, your primary nursing actions have to lock in on fluid management. You need meticulous assessment and documentation of intake and output. You'll be initiating IV fluid resuscitation and replacing those electrolytes. But here's a crucial intervention that sometimes gets missed. You must monitor for infection, like peritonitis, and keep a surprisingly close eye on their respiratory status. Interventions to promote breathing are a huge priority here, mostly because you've got massive abdominal distension pushing right up against the diaphragm. Moving right along to Section 4, Chronic Kidney Disease Care. CKD is defined as an abnormality in kidney function or structure that lasts longer than 3 months. For most adults, this is a progressive downhill slide that can ultimately lead to life-threatening kidney failure. As a nurse, your whole focus is on interdisciplinary management to delay that progression while aggressively anticipating a whole web of interconnected systemic problems. It really helps to look at exactly what the nursing problem is and tie it straight back to its physiological cause. For example, the patient has excess fluid volume. Why? Because of decreased kidney function. That leads right into the next problem, decreased cardiac function, which is caused directly by that fluid overload and increased peripheral resistance. They also have a super high risk for infection from vascular access or catheter contamination, and they experience profound fatigue due to uremia, anemia, and malnutrition. Your care plan has to address every single one of these cause and effect relationships. And finally, Section 5, COPD Nursing Strategies. We all know COPD involves persistent respiratory symptoms and airflow issues, but from a nursing care plan perspective, you have got to remember that COPD goes far beyond just the lungs. This disease causes systemic inflammation and a massive increase in the physical work of breathing. These patients are essentially running a marathon just by trying to pull in air, and because of that, they dramatically burn through their calories.
Because they're burning so much energy, your interventions have to cover multiple body systems. Obviously, you're monitoring oxygen and you're managing their oral meds, inhalers, and antibiotics. But you must also actively initiate nutritional screening and get consultations to combat that extreme calorie expenditure. Your care plan has to account for altered nutrition right alongside inadequate respiration.
So as you step onto the med-surg floor and face the increasing complexity of these hospitalized adults, keep this cheat sheet in the back of your mind. Whether you're educating a patient on crisis triggers, monitoring cap refill, tracking exact INO, mapping the systemic failures of CKD, or getting nutritional consults for COPD, your structured, evidence-based interventions are the ultimate safety net. It really makes you wonder, how will your specific vigilance today directly alter the survival trajectory of the patients in your care tomorrow? Something to think about. Thank you so much for joining me for this explainer. Take these care plans, apply them to your practice, and keep learning.